going. Start streaming. All right, guys, how you doing? You got another edition of Mondays with Mike, live stream Q&A. Ask me anything, health related. You know the deal. Just ask those questions. Put them down below in the comment box. And yeah, so we're going to be doing, as usual, we have the live questions coming in, but we're also going to start covering some various topics that have been asked me otherwise. So different things have been asked me throughout the course of the week, et cetera, et cetera. So while I'm waiting for you, we'll put my first one in that we have is one related to magic mushrooms and their ability to help treat depression. So let's see what we got here. So this is a story from Vice, and actually I meant to drop that into the description so you can see it. But then from there, we're going to look at the actual research behind it. So we'll see what else is going on. But let's read through this as we're going through it. So let's see. Active ingredient in shrooms could reset brains of depressed people. All right. And this is a relatively new article that came out on the 13th. Psilocybin, the active compound found naturally in magic mushrooms, has shown promising results in treating anxiety and depression. A recently published study reinforces the potential, demonstrating that depressed patients treated with psilocybin showed reduced symptoms even weeks after they'd used it. Even more intriguing, before and after brain scans showed changes in brain activity associated with significant and lasting decrease in depressive symptoms. And we also have the study right here. So unfortunately, it doesn't appear to have the full study available. Oh, never mind. Yes, it does. We actually do have the ability to watch the whole one, but for whatever reason, can't actually get the PDF. Oh, son of a B. Never mind. Completely disregard what I said before. We have the full PDF. I was going on PubMed before, and it wouldn't let me get it. I don't know why. But yeah. So I will start putting those down below in the description box so you can read those. But again, any other questions you have, definitely start asking. But we'll start going through these as I put these in. Nice. Glad that it has the paper. So if you want to pull that up, bam. So we'll go through the paper itself in a little bit, but for now, keep going with the original article that inspired this one. So, study conducted by researchers at Imperial College London is a small one. 20 patients with treatment-resistant depression received 2 doses of psilocybin a week apart. 19 had brain imaging done before their treatment, with an after scan coming a day after the second, a higher dose. Researchers used the images to compare changes in blood flow and in crosstalk between brain regions. Via MRI imaging, they saw a reduced blood flow to the temporal cortex. Most importantly, they saw a decreased flow to the amygdala. The small almond-shaped region helps to process emotional fears, responses, and stress. The researchers found a significant relationship between the decreased flow in this region and decrease in depressive symptoms. So let's see if the data backs that up. Do we have some charts? Ooh, look at that. We have a nice little pretty visual right there. We have their before and after. So we start to see where it's starting to fire. If you look, it calms down right there. So in figure 1, which one's figure 1? Yep, that's figure 1. Whole brain cerebral blood flow. Whole brain cerebral blood flow. Round 3. Whole brain cerebral blood flow maps for baseline versus day 1 post-treatment plus the difference map are cluster corrected. Correlation chart shows post-treatment changes in bilateral amygdala, CBF, or what is CBF? Cerebro fluid? Cerebral blood flow, the word that we used before. Got it. Cerebral blood flow. So CBF versus changes in depressive symptoms. One patient failed to be complete the scan in scan 2, reducing the sample size to 15 for the correlation analysis. In all the images, the left of the brain is shown on the left. So we look here, the before and afters. Gotta take my podcast, my Coastal Crap Kombucha sip. No, they're not sponsored, unfortunately. I got them to sponsor me. So we have a couple here. So you had to see the amount of blood flow that's going to the brain after that. So if we look here for quite a few of them, and if we look, we see a little bit less blood flow going on after the treatment. So it's not as fired up in those regions. All right. So we'll just go to the discussion for now. Methods are past it. Never mind. It's going back. All right. Let's zoom that in. See if we can see that. Let's push that over. What the heck? Oh, there we go. Now you can read it. In conclusion, here we document for the first time changes in resting state brain blood flow and functional connectivity post-treatment with psilocybin for treatment-resistant... Can't talk tonight. My brain's fried after jiu-jitsu. I'll have to take some psilocybin myself, I guess, right? So, round 2. In conclusion, we document for the first time changes in resting state brain blood flow and functional connectivity post-treatment with psilocybin for treatment-resistant depression. Decreased blood flow was found to correlate in the amygdala with reductions in depressive mood, which, as you saw in those pictures before, happened to be the case. Increased with DMN RSFC was observed post-treatment using both seed and network-based analyses, and specific increases in RSFC between the BMPFC and bilateral ILPC nodes of the DMN. Yeah. Probably make more sense if we read the rest of the paper. But were greatest in individuals who maintained treatment response at 5 weeks. Finally, decreased was observed post-treatment, and this was also predictive of treatment response at 5 weeks. An exploratory post-hoc analysis revealed that acute peak or mystical experience during the high-dose psilocybin session was predicted of these changes. This study is limited by its small sample size. There was only 15 for come time of correlation analysis, and absence of a control condition. Moreover, correction for multiple testing was applied to the full RSM, but not the specific hypothesis-tested ROI analyses. Future research with more rigorous controls should help to challenge and develop the present study's findings and inferences. Assessing the relative contributions or potential interactions between different treatment factors, such as the drug and accompanying psychological support, may be particularly informative next step. So the key here is that when we're looking at this paper, we are looking at research that's being done now in depressive patients who did not actually success with antidepressants. So that's a big deal. They had mentioned in the Vice article that it echoed a health craze kratom. Nice. That it echoed previous research. Okay, or rather, let's go by this first. Several of our patients described feeling reset after the treatment and often use computer analogies. Said Robin Carhart-Harris, who led the study, in a statement. For example, one said he felt like his brain had been defragged like a computer hard drive, and another said he felt rebooted. Psilocybin may be giving these individuals the temporary kickstart they need to break out of their depressive states, and these results do tentatively support the reset analogy. Okay, so now, full disclosure, full warning, full PSA on this one. That does not mean people with depression should start self-medicating with magic mushrooms. Just saying, I didn't advise you to. But, though the results are promising and echo previous research, which would be this study right here, as well as this one right here. Oh, this is the one from before. Huh. Is this the one that I was looking at? I didn't... Or is this a new one? No, this is the one, sorry. This is the one they were talking about before. So psilocybin is Carhart again. Psilocybin with psychological support for treatment-resistant depression. All right? That's a different one, I think. Yes. Yes, this is the previous research they were talking about before. Open label feasibility study. So we'll talk about this one in a second too. But going back to this, Though the results are promising and echo the previous ones, the study is small. Like we said, it's only about 15 people, and conducted without a control group. The research also provided a controlled therapeutic setting for the patients. Trained professionals were managing the psilocybin trip. Right. So that's a big concern when it comes to any kind of use when it comes to magic mushrooms, is that you have a bad trip, right? So you want to make sure the conditions are correct. The fact is that in the study, just like in a lot of conditions, things we see in a lab aren't necessarily going to translate out to real life. The fact of the matter is, though, that this study, along with some other ones, do show some promising potential when it comes to respect to magic mushrooms. Now, we've talked about medicinal mushrooms before, which are more just general stress related, more control of the adaptogenic properties, so more control of the adrenals, more control of the thyroid and hormonal processes, that fun stuff. But nevertheless, it still is some very interesting research. So we're going to do next, though, let's go to that previous research. All right. And we have psilocybin with psychological support for treatment-resistant depression, open-label feasibility study. And I'm going to go and we'll slap in the ResearchGate version of it. Interesting. Oh, it's done. It's got a delay. I will slap in the ResearchGate papers of these into the description as well. That way you guys can take a look at those. I'll add the citations later, guys. Don't mind me. We're going to take a look at both of these. And the beautiful thing on these ResearchGate ones is that they both are available for everybody. You get the full paper. All right, so let's see what we can see here. That one's 2011, and this one is, oh, hey, let's escape that. This one's 2016. Let's go with 2011 first. Let's go a little bit older research. Starting with cancer. So anxiety during cancer. Excuse me. Researchers conducted extensive investigations of hallucinogens in the 1950s and 60s, but by the early 1970s, however, political and cultural pressures forced cessation of all projects. This investigation examines a potential promising clinical application of hallucinogens in the treatment of anxiety reactive to advanced stage cancer. To explore the safety and efficacy of psilocybin in patients with advanced stage cancer and reactive anxiety. So this one is a double-blind, placebo-controlled study of patients with advanced stage cancer and anxiety, with subjects acting as their own control, using a moderate dose, 2.2 milligrams per kilogram of psilocybin. A research unit within a public clinical research unit within a large public sector academic medical center. There were 12 adults with advanced stage cancer and anxiety. So again, super small. Part of it has to do with the fact that most of the research, has, as I mentioned before, has been kind of pressured away just because people don't like to talk about hallucinogens anymore. It's kind of nowadays it's starting to get a little bit of a less taboo, but for a long time there, it was very, very taboo. So in addition to monitoring safety and subjective experience before and during experimental treatment sessions, the follow-up data, including results from the Beck Depression Inventory, profile of moods and states, and the State Trait Anxiety Inventory were collected, unblinded, for 6 months after treatment. Results. Safe physiological and psychological responses were documented during treatment sessions. There were no clinically significant adverse effects with psilocybin. The State Trait Anxiety Inventory Trait Anxiety Subscale demonstrated a significant reduction in anxiety at 1 and 3 months after treatment, and the Beck Depression Inventory revealed an improvement of mood that reached significance at 6 months. The profile of mood states identified mood improvement after treatment with psilocybin that approached but did not reach significance. Now, that being said, what that indicates is that in those 12 people, part of the problem there, and I'm sure if we look to the limitations of the study, is going to be that the power was insufficient. 12 people a lot of times is not adequate amount of people to find significant trends, statistically speaking. So because of that, that could be why it did not reach significance but trended towards it. Yeah, so this study established the feasibility and safety of administering moderate doses of psilocybin to patients with advanced stage cancer and anxiety. Some of the data revealed a positive trend towards improvement of mood and anxiety, but these results support the need for more research in this often neglected field. So this one looks like a pretty interesting study overall. We'll bring it down. He said you can take a look at it. The link is in the description, so if you want to read it yourself. Yeah, we have a nice little graph right here. Let's see what we got. Positive derealization, positive depersonalization, altered sense of time, positive mood, mania-like experience, anxious derealization, thought disorder. So we had a little bit of on the excitatory end. We got some jumps, and then delusion, fear of loss of thought control, fear of loss of body control. Those all dropped. Elementary hallucinations, visual hallucinations, synesthesia, change meaning of percepts, facilitated recollection, and facilitated imagination. Those all jumped on the psilocybin group versus the placebo group, which all stayed down generally towards the baseline. All right. We have here the different depression-based scores, and we see a little bit of a net benefit, right? On the anxiety scores, placebo versus the psilocybin, there is definitely a lower trend on the psilocybin. So we see some benefit. Again, on anxiety, there is a reduction in depression. In anxiety. We said before about the depression, there was the reduction, as we see here, a net reduction. And if we go through, we'll see here the limitations. So, although we use a within-subject, double-blind, placebo-controlled design, the drug was almost always apparent to subjects and investigators whether the treatment was psilocybin or placebo. Yeah, you're kind of going into the game knowing whether or not what you're getting is, in fact, psilocybin. Yeah, it's kind of hard to blind completely whether or not you're getting a magic mushroom, or at least the active ingredients thereof. So, yeah, there's definitely no question there. It's going to be a hard one to try to fix in order to blind. What you'd have to use as control other than psilocybin would have to be another hallucinogen type pharmaceutical. So with that, you'd have to do something along those lines in order to make it so that it wasn't, abundantly clear that's what you were getting. Yep. All right. Let's see. I'm going to open this up a little bit. Cool. All right. Consistent with previous research, we found no untoward cardiovascular sequelae in our subject population. Minor heart rate and blood pressure elevations after psilocybin administration were evidence of only a mild sympathomimetic effect. Holter and monitoring did not identify increased cardiac arrhythmias in comparison with niacin placebo, even in subjects who presented with some baseline cardiac arrhythmia. Niacin may, I don't say actually, but acutely lower blood pressure through vasodilation, but have minimal effects on blood pressure and heart rate in our subjects, except for a reduction in diastolic blood pressure that was noticed 1 hour after administration of niacin. This transient effect may have contributed to our detection of significant psilocybin effect at that time, but cannot explain the significant effect of psilocybin over the subsequent intervals, because the initial niacin-induced reduction of diastolic blood pressure did not possess. It's not really as important as what we're talking about. Oh, yeah, duh. I rewinded from where we were. My bad. Sorry, guys. Future studies will also need to address the issue of controlling for placebo effect that might otherwise be attributed to the active treatment. Yes, definitely a major concern. You're getting the mushroom, you're going to say, oh, well, I got the mushroom now. I'm supposed to be happy, so I'm going to be happy now. Or I'm not supposed to be anxious, so I'm not going to be anxious. There's the whole concept thereof of going into the equation saying, oh, well, I'm going to be transported to a whole other world. There's nothing to fear here. That being said, it's kind of hard to say that it doesn't do something, right? Anyway, given the subject's grave prognosis and limited life expectancy, we decided to provide all subjects with the opportunity to experience the experimental medicine and to serve as their own control. Right. So again, in this initial one, it was, cancer patients. Ones who were at advanced stage and likely were not getting out, I use likely kind of loosely. So they decided, screw it. Let's let these guys get high one more time, and we'll monitor it, make sure it's okay. Better experimental design might incorporate an independent control group receiving only either placebo treatment or conventional psychopharmacological interventions. Although there is no question that the extensive attention paid to the subjects influenced outcomes, the unique qualities of psilocybin experience in facilitating strong therapeutic bonds and ameliorating underlying psychological demoralization are important factors worthy of further exploration. Another limitation of the study was the variability in the extent of contact with subjects after treatment. A minimum contact of 1 hour monthly was established, but variability and additional ad hoc communication depended on the needs and wishes of the subjects, some of whom were near death compared with others who were more functional. Despite these limitations, this study demonstrates that careful and controlled use of psilocybin may provide an alternative model for treatment of conditions that are often minimally responsive to conventional therapies, including the profound existential anxiety and despair that are often accompany advanced stage cancers. And a recent review from the Psilocybin Research Group at Johns Hopkins University describes the critical components necessary for ensuring subject safety in hallucinogen research. So taking into account these essential provisions for optimizing safety as well as adhering to strict ethical standards of conduct for treatment facilitators, the results provided herein indicate the safety and promise of continued investigations into the range of medical efforts of hallucinogenic compounds such as psilocybin. So, pretty cool. Now, if we look here, submitted for publication August of 2009. How crazy is that? So the paper didn't get published until 2011, but the research was done and ready to go. The paper was written back in August of 2009. So that was almost 10 years ago at this point. It's crazy. Huh. It says here, downloaded on 2010. So it's 2010, 2011. Wow. And again, that shows you how crazy it is. So it was available online in September 2010 and didn't actually get published in the paper itself until January of 2011. Woo! All right. Moving forward, let's look at the other previous one. So this one here is from 2016. We have, and we will see later on when it was actually written and published, right? So psilocybin is psilocybin with psychological support for treatment-resistant depression and open-label feasibility studies. This one here was done before the other one, the original one the mice article was based on. And so psilocybin is a serotonin receptor agonist that occurs naturally in some mushroom species. Recent studies have assessed the therapeutic potential of psilocybin for various conditions, including end-of-life anxiety, obsessive-compulsive disorder, and smoking and alcohol dependence, with promising preliminary results. Here we aim to investigate the feasibility and safety and efficacy of psilocybin in patients with unipolar treatment-resistant depression. So, one specific type of depression. Basically, they're on the one end, and they aren't seeing success with the other medications. So in this one, they took 12 patients, 6 men, 6 women, with moderate to severe unipolar treatment-resistant major depression, and they received 2 oral doses of psilocybin, 10 milligrams and 25 milligrams, 7 days apart, in a supportive setting. There was no control group. Psychological support was provided before, during, and after each session. The primary outcome measure for feasibility was patient-reported intensity of psilocybin's effects, and they were monitored for adverse reactions during the dosing sessions and subsequent clinic and remote follow-up. So they assessed it using the quick inventory depressive symptoms, serving as a primary efficacy outcome, and they registered there. So this one provides preliminary support for the safety and efficacy of psilocybin for treatment-resistant depression and motivates further trials with more rigorous designs to examine better the therapeutic potential of this approach. So if we go through here, Ooh, that's a fancy one too. Look at that. Low dose, high dose. They did the post-treatment fMRI, MRI assessment, and interim questionnaires. They followed them up. There were 72 people who they originally expressed interest in the trial. 34 were excluded because they didn't meet the criteria. 38 were telephone screened. 20 were excluded because they did not meet that entry criteria. 18 attended the screening visit, and then 6 more were excluded because of insufficient severity of depression. So they really wanted to make sure these people were the worst of the worst, the ones who really saw nothing. And so, looking at it's pretty impressive. They gave, ethnic origin, employment status, estimated illness, baseline scores, or length of illness rather, past unsuccessful medications, past psychopathy, psychotherapy. Whoops. Sorry, guys. Education, weekly alcohol intake, and previous psilocybin use, time since use. 3 uses 30 years ago. Wait a minute. That doesn't make sense. Oh, time of illness. Second. 52-year-old. I'm like, 27 years ago. So, this person, though. This person used psilocybin 30 years ago and's had depression for 27. That's not really a good sign right there. 3 uses 48 years ago. Estimated time of illness, 15 years. Wait a minute. Did psilocybin cause it? Probably not. So this one here, you can read through this one. We're just about done. Long and the short of it is that quite possibly could be beneficial. So interesting stuff. Hey, Shoshana, how you doing? Yeah. Ask some questions. Shoshana, you haven't been asking questions lately. You've been slacking on your question asking. So you joined in late. It's all good. We've been talking about magic mushrooms and depression. So interesting one. Next one, though, we're going to look at, while we're looking at the questions coming in, was a recent study published back in August. Dietary capsaicin, so eating cayenne and other hot peppers, can improve glucose homeostasis, which is the regulation of glucose, and actually alter the gut bacteria in obese diabetic mice. So we're going to open the actual paper here. So we get to the PDF, because I like that more because it's prettier. Now I'm just going to copy this real quick and let you guys take a look at this. I'm going to drop this also into the discussion board, or rather the description down below. What is the time on the clock? We're at about 28 minutes. I'm actually going to try and put a little timestamp on that bad boy. I'm trying to get a little fancier with this, All right. So, dietary capsaicin improves glucose homeostasis and alters gut microbiota in obese and diabetic mice. Hold on. Boom. All right. So, dietary capsaicin improves glucose homeostasis and alters, I said this already. The effects of capsaicin on obesity and glucose homeostasis are still controversial, and mechanisms underlying these effects remain largely unknown. This study aimed to investigate the potential relationship between the regulation of obesity and glucose homeostasis by dietary capsaicin and alterations in gut microbiota in obese diabetic mice. So they went and took a number of mice, followed them for 6 weeks, and they'll observe their obesity phenotypes, the regulation of blood sugar, and their gut bacteria composition, as well as short-chain fatty acids, gastrointestinal hormones, and pro-inflammatory cytokines were measured. Both low and high capsaicin diets failed to prevent the increase in body weight, adiposity, and lean obesity index. However, dietary capsaicin at both the low and high doses significantly inhibited the increase of fasting blood glucose and insulin levels. These inhibitory effects were comparable between the two groups. Similarly, dietary capsaicin resulted in remarkable improvement in glucose and insulin tolerance. In addition, neither the low nor high capsaicin diet could alter the alpha diversity and beta diversity of the gut microbiota. Taxonomy-based analysis showed that both the low and high capsaicin diets, acting in similar ways, significantly increased Firmicutes and Bacteroides ratio at the phylum level, as well as increased the Roseburia abundance and decreased the Bacteroides and Parabacteroides abundances at the genus level. That's just basically the family versus the phylum versus the genus, and then rather than individual species. But anyway, Spearman's correlation analysis revealed that Roseburia abundance was negatively, while Bacteroides and Parabacteroides abundances were positively correlated to the fasting blood glucose level, an area under the curve by oral glucose tolerance. Finally, the low and high capsaicin diet significantly increased the fecal butyrate, which is a good fatty acid, short-chain fatty acid produced by the bacteria, as well as plasma total GLP levels, but decreased total ghrelin, tumor necrosis factor alpha, interleukin 1 beta, and interleukin 6 levels compared to their normal diet. Beneficial effects of capsaicin on glucose homeostasis are likely associated with alterations of specific bacteria at the genus level. These alterations in bacteria induced by dietary capsaicin. Round 2. These alterations in bacteria induced by dietary capsaicin contribute to improved glucose homeostasis through increasing short-chain fatty acids, regulating gastrointestinal hormones, and inhibiting pro-inflammatory cytokines. However, our results should be interpreted cautiously due to the low caloric intake at the initial stage of capsaicin diet administration. So, short version of what that is. So, before we talked about the total ghrelin, ghrelin is a type of hunger hormone. Tumor necrosis factor alpha and interleukins, both 1 beta and 6, are inflammatory cytokines. They are regulating molecules that tell your body whether or not we are inflamed. Kind of. They basically transmit the inflammation process. So if you have elevations in that, you generally have some inflammation going on. That being said, Kaelen appears to help. Cool. Was looking at that as I was going through the research for the new Fire Cream website, which coming soon, right? Super exciting. That being said, Chia. Okay. So, I'm sorry. Magic mushrooms. Nice. Yes. So, my question is benefits of chia seeds. Funny enough, I actually have not done a video on chia. I just went and looked to verify, and funny enough, no bueno. I haven't done it. That being said, chia seeds, I am kind of agnostic on. We'll pull some research for you right here. Regarding their use, personally, not really the biggest fan, but they're probably not going to be too problematic. So our biggest problems are that they are touted as if they are the end-all, be-all superfood. But the fact of the matter is, there are better sources of protein, there are better sources of the omegas, there are better sources of fiber. That's one of the other big ones that chia is touted for. If, however, for one reason or another, you absolutely have to get chia in your diet, it's probably pretty benign. It falls under the class similar to like quinoas and buckwheats and amaranths. It's like a pseudo grain. It's not quite a grain. It's not going to cause the same deleterious problems, but it's not the magic that a lot of people try and make it out to be. And we will pull it up in a second. Hold on. Just add that to the description. Speaking of magic mushrooms, my friend is a cannabis doctor and insists that I should be on vape cannabis, medically prescribed, of course, because it will not only aid in major pain issues, but, and I'm ending right there, don't see, ... and in major pain issues, but and actually, it's funny that you say that because, wait, chia is salvia? Wait a minute. Huh. Salvia hispanica? Time out. Also, aid in reducing swelling from lipedema and lymphedema. What are my thoughts on that? It's funny that you asked that because, we'll come back, we'll do this, we'll add this one in as well. But it's funny that you asked that because I was actually going to be talking about this here. An update on the safety and side effects of cannabidiol, a review of clinical data and relevant animal studies. And this one is a relatively brand new one as well. It's a June 2017 paper. So we'll come back to this one in a second. But let me actually open that up as well so we can add that one in. But we'll go back to the chia seeds. We'll finish up with this real quick. This ancient grain, again, pseudo grain, is becoming enormously popular in modern food regimen in many countries. The high proportion of alpha-linolenic alpha-linolenic acid makes chia the superb source of omega-3s, about 65% of the oil content. Cool, but it is a precursor omega-3, which we've talked about the problems with that before. Short version on that is that omega-3s need to get converted to the long form through processes that are not particularly efficient. And, did I not? That's another one that I thought I had a dedicated video on, but apparently not. I have the fish oil and krill oil. Whatever. Short version, omega-3s have to get converted through. It's not the most efficient process. You don't get all of them in the process. You really want to be getting in preformed EPA and DHA. And I will just add that in anyway. I will add the link for that bad boy. I will add that as a card up top, so you'll be able to look. Probably there. Maybe there. one of those sides. Okay, we're going to add a video. Dun, 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 dun. All right, so up top you'll be able to see in a second one of those sides. All right, moving forward. Yeah, you know what it is. There's a delay, so I probably see them almost immediately after you post your questions there. The problem is there is a delay between when you see what I see and what I'm saying based on what's there. I'm sorry. Sorry for the lag there, but that's just the way the YouTube system works. Yeah, you have to factor in this information is going all the way to space and then coming back down, and it's pretty magical. But back to chia seeds. The omega-3 fatty acid has been associated with a large number of physiological functions in the human body. Chia seed is a potential source of antioxidants with the presence of chlorogenic acid, caffeic acid, myristatin, quercetin, and camphorol, which are believed to have cardiac, hepatic protective effects, and anti-aging and anti-carcinogenic characteristics. It's also a great source of dietary fiber. It's kind of funny. It's almost like I nailed all those points, didn't I? Which is beneficial for controlling diabetes mellitus, and higher concentrations of beneficial unsaturated fatty acids, gluten-free protein, which I said before, vitamins, minerals, and phenolic compounds. Therapeutic effects of chia in the control of diabetes, dyslipidemia, hypertension as an anti-inflammatory, antioxidant, anti-blood clotting, laxative, antidepressant, anti-anxiety, analgesic. Vision and immune improver is scientifically established. Who's the publisher of this paper? The Journal of Food Science and Technology. All right. So again, like I mentioned before, it's literally the three that I hit. I said protein, omega-3s, and fiber. Decent sources of all three. Not the worst. Could have some benefit. I will link to this bad boy down below as well in the description so you can see it. My biggest problems come from the sources of anti-nutrients. Let's see if they mention anything about that. Like phytic acid. Nope. Phytochemicals. Nope. Aha. Approximate composition of anti-nutritional factors and proteins of guar gum seeds as... They didn't want to talk about that. They talk about it, but they don't talk about it. Let's see. Ahmed is the... Can be used as a condiment flavor enhancer. Okay. Insect control. Excuse me. All right. So I'll just drop that down below as well so you can take a look at that. But, you know, nothing really too crazy going on there. Bam. Okay. Let's see. Chia seeds, anti-nutrients, and CBI. Promising future. However, the high... Okay, this one is talking about the anti-nutritional count of flaxseed. Let's see. Anti-nutrient. Affected the poultry and meat quality. Several crops have been recognized as being good source of oil for dietary use, including flaxseed, rapeseed, sunflower seed, soybean, and chia seed. Ugh. However, eggs fed from hens with chia seed have the highest omega-3 ALA content as compared to hens fed with flaxseed. No. Nope. Just gonna keep moving past that before I. Let's see if we talk anything about fighting. No. So, long and the short of it is, I mentioned this here. Biggest problems come in from the omega-3, the omega-6s, the preform omega-3. Not terrible. Probably be all right. Take a look. Make the benefit for yourself. But apparently they are going to be more absorbed due to lack of anti-nutrients than, say, flax. So the omega-3 sourcing on chia is going to be better than it would be from flax. Cool. Regarding the use of, cannabis vapes, big fan. Big fan overall. That being said, this here appears to be an interesting study that I came across earlier. And again, this was from June regarding, it's an update on the safety and side effects of cannabidiol. A review of clinical data and relevant animal studies. Now, this is particularly important because I am a big fan. I promote CBD from edibles, Alchemist Closet, change the name, Alchemist Closet, as well as the new fire cream is going to be containing CBD as well. So this here is something regarding the safety and side effects, right? There really isn't too much, but let's see what we got going on. Apart from updating literature, this focuses on clinical studies and CBD potential interactions with other drugs. In general, the often described favorable safety profile of CBD in humans was confirmed and extended by the reviewed research. Let's pull up in the PDF. I don't really like looking at it this way. It's always painful to me. All right. Looks prettier. The majority of studies were performed for treatment of epilepsy and psychotic disorders. Here, the most commonly reported side effects were tiredness, diarrhea, and changes of appetite weight. In comparison with other drugs used for treatment of these medical conditions, CBD has a better side effect profile. These improvements could improve patient compliance and adherence to treatment. CBD is often used as an adjunct therapy. Therefore, more clinical research is warranted on CBD action on hepatic enzymes, drug transporters, and interaction with other drugs to see if this mainly leads to positive or negative effects. For example, reducing the needed clobazam doses in epilepsy and therefore clobazam side effects. And let's see, this was about 40 minutes in, so we'll throw that in as a ballpark. So, CBD, super safe overall, very effective. If you want more information on the potential benefits of it, particularly for pain and inflammation and reducing swelling, I have an article over on Rebel Health Tribe, and I will actually put that in the description as well. So, benefits. So check that out in the description, and you'll check that out at So man, we're talking about cannabidiol, magic mushrooms, getting in crazy right now, right? Getting in real crazy. All right. Title's too long. Screw you. All right. Wait. Okay. So at this point, basically, This review also illustrates the important toxicological parameters that are yet to be studied. For example, if CBD has an effect on hormones. Additionally, more clinical trials with greater number of participants and longer chronic CBD administration are still lacking. So yes, unfortunately, similar to the issues with mushrooms, these studies that are done, a lot of times, not necessarily the strongest studies in terms of the amount of people that are in it. However, I've seen anecdotally through working with clients and other people, tremendous results, very almost no issues going on. So here, in terms of benefits, at lower doses, it has physiological effects that promote and maintain health, including antioxidant, anti-inflammatory, and neuroprotection effects. For instance, CBD is more effective than vitamin C and vitamin E as a neuroprotective antioxidant and can ameliorate skin conditions such as acne. Boom. Craziness, right? If I said it's anxiolytic, meaning it reduces anxiety, it's anti-inflammatory, it's anti-emetic, helps to prevent nausea, and antipsychotic. So, great stuff. This comprehensive review has 132 original studies by Bergamaschi et al. Describing the safety profile of CBD, mentioning several properties. However, this idea, so chronic use and high dose of up to 1,500 milligrams a day have repeatedly shown to be well tolerated by humans. To give you an idea about how insane that is, most people do very, very well with 5 to 10 milligrams of CBD per day. Now, I know you were asking specifically about cannabis vapes and medically prescribed ones, which obviously will be containing THC and or other issues. Now, that being said, I don't see a particular issue with that, from a legal standpoint, if it's been prescribed, But overall, for people that are trying to see the benefits of the cannabis plant without having to deal with the cognitive impairment that comes with the THC, CBD is an excellent idea. If you are doing things that don't require as much cognitive functioning, the THC versions are great. So in terms of pain, bringing down inflammation, bringing down swelling, cannabis plant is an excellent idea. Cannabidiol, in this case, gives you all the benefits without the high and is, in fact, legal either way. So, again, if you have a friend who's a cannabis doctor, awesome. So, I definitely would recommend that overall. If, for whatever reason, it doesn't work out to you, reach out to me. We'll get some CBD for you. So, yeah, like we said, definitely does need some more research being done on it, but same thing with the psilocybin. Almost everything. There's always room to do a little more research on it. We can always learn more about it. But the safety profile as of June, was it June this one came out? Yeah, as of June is impeccable. So, brief psychiatric scale of CBD. That's talking about people with psychotic symptoms. Up to 1,500 milligrams per day for 26 straight days. Improvement of symptomology, no side effects. Another one, so it's brief psychiatric rating scale. Brief psychiatric rating scale. Mild improvement of symptomology of one patient, no side effects. Up to 600. Improvement in symptomology, no side effects. Yeah, another 300 to 600 milligrams. Performance after placebo and CBD compared to CBD 600 milligrams, no side effects on symptomology. Whoops. Well, that one apparently wasn't a good backup for the CBD. Whoops. So unfortunately, that one didn't work too well, but didn't mention side effects, right? CBD as effective as amisulfide in terms of improvement of symptomology. CBD displayed superior side effect profile. So again, that is in 39 people. Good stuff. And that's at 800 milligrams a day for 4 weeks. Crazy levels. All right. Long and the short, definitely a fan, definitely some benefit. Again, personal experience and the research definitely, it's mounting research, it's growing, but it definitely seems to back it up. So overall, big fan. Safety profile is second to none, practically. I want to learn what the cannabis does to relieve the pain. In other words, does it block the pain receptors or does it do something else? Is vaping more effective than the oral pill, etc., etc.? So, yes, like I said, I have the article that I linked down below, which was Cannabis Truth. So, I'll pull it up real quick. That way you can see. Let's go through that. Why not? I mean, obviously, afterwards, go and read it for yourself. I'll definitely start out with this here. Why not? Cannabis truth. So this is my article over on Rebel Health Tribe, who are some of my partners for the Fire Cream, by the way. Just throwing it out there. And regarding the vape versus eating an edible, the biggest difference is the rate of transmission. When you are vaping it or smoking it, it's going to go through your lungs. It's going to take longer to get there, or rather, it gets there faster. Excuse me. It gets there to the system faster, but it lasts less of time because it goes right in and it gets right into the system, and it's going to last for less time. The edible, you have to actually digest it. The breakdown process is going to go and take longer to actually get into your system, and because that actually ends up lasting longer overall. All right. So I don't know why this doesn't want to load all the way, but whatever. So in terms of how does it relieve pain, it does so partially through the opioid receptors, but also the pain receptors of, there's an endocannabinoid system. We have cannabinoid receptors. So basically cannabis fits into that there. So big question, how can it help you? So the body contains an endogenous cannabinoid receptor system known as the endocannabinoid system for short. I'm a little high there. There you go. Now, big question, how can it help you? Well, going through the pain. This was right after UFC 202, and we were talking about Nate Diaz and his vaping pen when he was talking about CBD. And the fact that it's legal here. That's just going past that. So anything that can reduce inflammation associated with training, can combat mental fatigue, will always be beneficial. How does it do it? Well, it reduces inflammation, the inflammatory cytokine interleukin 10. It also reduces interleukin beta 1 and interleukin 6, which we talked about before with, I believe it was the psilocybin, right? Was it the psilocybin? Was that the one that did it? Dun, 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 dun. Let's see. Pretty sure when we're talking about psilocybin, we talk about how it was able to reduce those inflammatory markers. Nope, wasn't that study. Dun, dun, dun. Nope, wasn't that one. What the hell was it? Was it the Kaelen? Maybe it was the Kaelen. Ah, yes, sorry. Whoop. So if you remember from before, we were talking about how the Kaelen was beneficial for your gut bacteria. Why? Because it decreased the interleukin beta 1 beta, and interleukin 6. Well, when we're talking about CBD, it has the same effect. It actually can lower the levels of interleukin beta 1, interleukin 6, interferon gamma, and tumor necrosis factor alpha, which again, we saw over here. So the effect of cayenne, which is also a very potent anti-inflammatory, big fan of that as well. Well, seems to be beneficial. How to do that? It ends up reducing those cytokines. Why is that important? Those cytokines are associated with the activation of nociceptive sensory neurons. Basically, the process of the neurons or the section of your nervous system that causes you to feel pain. Nociception is the feeling of the pain. Okay. The receptors that actually feel it. Okay. Additionally, the endocannabinoid receptor system, specifically the CB1 and CB2 receptors, play roles in regulating the inflammatory response and send the perception of pain. While CBD does not have a strong binding affinity for CB1 or CB2, it does modulate both of them by acting as inverse agonist. It acts by increasing the amount of available CBD receptors while competitively inhibiting the breakdown of the signaling molecules. What this means essentially is that while it doesn't score the touchdown, it blocks the other teams while helping the others to keep the receivers open. That made more sense when I wrote it than when I read it. Anyway, short version of that. What it does, the CBD in particular, what it actually does, it changes the shapes of the receptors of the endocannabinoid system, and it helps make it so that it helps make it so that the inflammatory response isn't as pronounced. It makes it so that the inflammation gets reduced because of that. All right. 4-minute delay when I hit send and it shows up on the screen. Sorry if it looks like I take forever to post. No, it's fine. Don't worry. It's not your fault. Okay, so part of it is the delay from when you're saying it, and the other part is when I'm ranting on something else. So when it gets to me, it's not going to show up on the screen for you for about another 30 seconds or so. Unfortunately, it's the nature of the beast. From there, I end up getting the notification. I'm probably ranting on something else. By the time I read it, then it's probably like that's why you see like a 4-minute delay. There's like a 30-second delay on when you see it, 30-second delay on when I'm able to get to it, maybe a couple minutes, and then there. Yeah. Anyway, so going through the rest of it, we talk about chronic inflammation, the in vivo, in vitro effects, talking about how it can be done both orally and transdermally or through the skin to help improve anti-arthritic activity and ability to improve joint function. Super important. The fire cream is going to have CBD in it. Why? It helps as anti-arthritic activity and can be beneficial orally and transdermally. Awesome. And internally, like whether it's being vaped or eaten. So good stuff though. So psychology here. Now this article was written specifically geared towards the athletic crowd. It was done after Nate Diaz decided to vape on the presser. So this one is engaged very much this way. So traumatic brain injury, irritable bowel syndrome, colitis, reflux disorder, autoimmune, most immune reactions. So super beneficial. That's the long and the short of it. And in case you want to learn even more, it just keeps going. So there are about 55 studies in this here one, and there actually is more research over on the Firecream website when that launches. I have some more studies that I've added since then, and that's of course on top of the cannabidiol review, which you can see down below. You can take a look at that one right now. It's in the description, and that has links to a whole bunch of other ones. And actually, there's another one I wanted to look at. We'll probably finish with this one here because we're about an hour. The role of endocannabinoids on neuroinflammation in the autistic spectrum disorder. So for people with autism, well, CBD might be super beneficial. Basically, has become autism spectrum disorder has a disease that's been mounting socioeconomic alarm among around the world. Neuroinflammation has been shown in postmortem brain specimens from ASD patients. The endocannabinoid system consists of a family of locally produced, short-lived, endogenous phospholipid-derived aggregates. Yeah, say that 3 times fast. That control energy balance and body composition. The growing number of medical benefits of the endocannabinoid system, such as their ability to regulate processes like neuroinflammation, neurogenesis, and memory, raise the question of their potential role as a preventative treatment of ASD. Just hypothesis, basic and clinical studies allow us through the investigation of the role of it in the pathogenesis of autism spectrum disorder. This hypothesis will help to understand the mechanisms of the endocannabinoid system and its role in autism spectrum disorder. So again, there's another one that is relatively brand new. This one came out in June. I can't do dates apparently. So we'll slap this one down below as well, just for funsies. All right. Basically, this nice little graph right here is explaining potential mechanisms on how and where in the endocannabinoid system it is pertinent, where it is actually becoming important, and how it can be infected. So hypothalamus, your adipose tissue, your muscle, the liver, the GI tract, and the immune system. What happens from there? What can it do? Or how does it react? It can cause an increase in food intake. It can cause a decrease in apoplectin and an increase in lipogenesis, or the increased production of fat. Decreased sugar uptake by the muscle. Increased fat uptake by the liver. It causes decreased satiety, so less feeling of hunger, and decreases in inflammation. Effects: subsequent effect because of that mechanism: body weight, waist circumference, visceral fat and dyslipidemia, insulin resistance again, dyslipidemia, and wait for it, insulin resistance, body weight and circumference, but it can also lead to neuroprotection. So depends on which ones we're talking about, the CB1, the CB2 receptors. CB2 in particular will have a lot of roles on your immune tissue, immune cell and tissues there, as well as the neuroinflammation. So the CB2 receptors seem to be the important ones with respect to the brain development. So right here could be some interesting research they're going to be doing. Protective effect against beta amyloid-induced neurotoxicity, which would be Parkinson's, Alzheimer's. Yes, Alzheimer's. Yes. Anyway, experimental models of multiple sclerosis, stimulation of CBI, CB1, CB2, or is that a 1 or an I? Meh, whatever. Block cellular uptake in the receptors has been shown. So I got distracted there and lost my spot. Has great potential, and animal experiments have shown encouraging results in reducing clinical symptoms in degenerative and inflammatory disease conditions. So again, inflammation, and swelling. That's kind of important. You're asking specifically about swelling, so there you go. So we'll just slap this one down below as well. Save. All right. So yeah. If we have any last questions, I have it open over here too. I'll take a look real quick. Last questions, slap them down below. Otherwise, you guys know the deal. Like and subscribe. I truly appreciate it. Had a lot of fun topics we talked about tonight. Talked about magic mushrooms. Talked about chia seeds, CBD oil, cayenne for the gut bacteria. Yeah, I think we got some good topics covered tonight. So definitely enjoy those. But also, obviously, keep your eyes out. The fire cream will be coming soon. All right, so be ready. If you haven't already, head on over to Facebook. Head on over and like firecream.com. Sorry, facebook.com/thefirecream. And I will pull that away for now. Or rather, let's minimize that so we're not blasting my messages to people. Hey, get out of here. I'll put it down below in the description. Make sure you follow the Fire Cream on Facebook, please, because it will be coming soon and it's going to change your life. Particularly if you're dealing with pain and swelling inflammation. So I'm sorry if we haven't really talked about that before, but definitely, Shoshana, you should be looking at the Fire Cream. Yeah, I feel like I had to have told you that at some point. And also, as we see here, I got some excellent reviews. If you haven't already left me a review, if you could please, I would greatly, greatly appreciate it. But we have a lot of beneficial reviews here. Where are the reviews? There we go. Kill up the knee in half the time. Great cream with the old achy back. You don't need a lot. Highly recommend it for whatever ails you. And you can't see half of that, can you? Dun, dun, dun. There you go. Using the Fire Cream for years and through several fight camps, nothing else compares to it. For pain, soreness, injury, it's always the best. Been using Fire Cream for years. Hey, get out of here, Mike. He's trying to sneak onto my live stream here, huh? Sneaking in. All right. On that note, I think we're going to kill it. Guys, thank you very much for joining me. If you're watching on the After Effects, either way, on the replay, even crazy, you made it this far. Either way, guys, greatly appreciate all the support. And yeah, love you. And I'll see you probably next week.